Hello everyone, I hope you all are fine and updating your knowledge day by day. So, in continuation with our lecture number 8, in which we studied about the ATC, WHO ATC classification of drug. Now, in lecture 9, unit 2, we are discussing about the international classification of disease. Okay, remember the terminology. In lecture 8, we have discussed about the different classification of drugs. Now, in lecture 9, we are going to discuss about the international classification of disease, which is considered, or in short we can say it is a ICD system. Okay, students. So, ICD is a universal abbreviation which means the international classification of disease as well as triple D. I remember in our last lecture, in the previous lecture, I was telling you about the triple D, which is the defined daily defined dose. Means we are having different classification of system in which one is chemical and the control substance, which is given according to the dose under proper control. We have to monitor the patient after giving that particular class of drug, because the dose only tells about the therapeutic or the desirable frequency, or we can say the undesirable or the deleterious health related hazardous responses. So, let us start with ICD. ICD stands for International Classification of Disease. So, it is the complete name is International Statistical Classification of Disease. So, can anyone tell me why we are going to use this statistical terminology here? Because the word or the method statistical calculation is very important. The role of biostatistician in every field, or we can say while we are discussing the dose, calculating the doing the posology or the dose prescribing for the children to the elderly, or we can say geriatric population, we are required a biostatistician to calculate the exact dose of the drug, which will not showing any serious health related defects in the population. So, the complete name of ICD is the International Statistical Classification of Disease and Related Health Problems. In short, you know, it is the ICD. So, ICD, when anyone asks you define the ICD, you can say it is the international standard or the diagnostic tool to study in detail about the epidemiological aspects, the health management and the clinical purpose of prescribing drug in different category of patients. So, I hope you are knowing about the epidemiology. Logy means students study. So, what you are going to study here? Epidemiology means in the large scale or large population, we are going to prescribe a similar class of drug to a particular diseased patients. Like I am giving you one example of suppose chikungunya, or we can consider a area where, like for example, nowadays we are running with a pandemic condition where most of the people are affected before few months from the COVID-19 and which is coming as a pandemic situation. So, it is the epidemiology, means where we are going to study a large number of patients who are affected from certain or similar disease. So, that is why to study sequentially the epidemiologically, to manage the different class of patients starting from the children to the elder, and also to manage the clinical patients with more and more therapeutic benefits and least health related risk. Okay. So, we are going to use this ICD, that is the International Classification of Disease system. Now, coming to ICD in detail, the ICD is designed as healthcare classification system which provides the proper diagnostic codes. So, in ICD system we are going to study different codes for classifying different class of disease, including the classification of wide variety of sign, symptoms, the abnormal findings from that particular class of patients, the complaints received from the patients, the social circumstances, or we can include here the socio-economic conditions of that particular group of patients, and the external causes of injury along with the disease. So, I hope you get this point. ICD basically describe various codes which will ultimately cover the sign and symptoms, which is nothing but the etiological features of the patients, means the cause or the morbidity conditions or the disease disorder the patient are going to report you. You means the physician or the healthcare staff, and he or she also telling you the abnormal findings, means after taking that particular drug, I am feeling like nausea, vomiting, dizziness, ataxia. So, I am going to report a pharmacist or any healthcare staff, any physician, or I am going to tell you my complaints after taking that particular drug, the socio-economic conditions and the cause of injury or the cause of the generation or the progression of that particular disease. So, this ICD includes the analysis of the general health condition of the different group of population. So, different group means here students, like we have the children, then we have teenager group, then we have adults, then we have elderly. Okay. So, it is this ICD classification of disease, this system is used to monitor the incidence. Incidence means the chances of occurrence or acceptance of particular disease, like I am having immunosuppressive, now I am having more prone to acquire that particular disease. Okay. The incidence as well as the prevalence of any disease along with the other health related problems. So, it is basically used for the reimbursement and to provide the proper resource allocation, or also this ICD system helpful in decision making by various countries. So, for this students, we are talking about not specific for any country, we are talking about the globally. So, ICD follow the global system classification of disease. Okay. It covers maximum all countries. So, the system defines the ICD coding given to particular country, like for Japan or America can be followed in India. Okay. So, it is considered to be as GHS system. I hope you know about the GHS classification system. GHS stands for globally harmonized system. Okay. Now, coming to its historical synopsis of ICD. So, you will see in the early 1860, the Florence Nightingale, he was the first who made the model of systemic collection of hospital data. Systemic means, yes, the patients or the clinical or the volunteers, or we can say the patients basically who are admitted for prolonged duration of time in the hospitals. This Florence Nightingale go and collect the data and summarize in their format, and this will be used, or we can say required for the generation or the startup of ICD classification of disease. After that, in 1893, another French physician named Jacques Bertillon. I hope you know about, you heard about the Bertillon theory of classification or the cause of death. So, Jacques Bertillon, they introduced Bertillon classification of cause of death, and it is it was at that time also play a very vital role for the generation of ICD system of classification, or the globally acceptable system for the classification of different diseases. Okay. Then in 1898, another American Public Health Association, which is in short APHA, American Public Health Association, recommended the revised version of ICD system in every 10 years. So, this statement means at every 10 years the ICD system is given their another code, means they include subgroup or they enlarge, widen their area according to the increase in scientific, diagnostic, or we can say the therapeutic tools and technology. In every 10 years this ICD system can be revised. Now, the revision followed in starting with the minor changes until the 6th version of ICD were there. So, we are having ICD 1 to 6th, which will describe about the morbidity or the causes of mortality in different class of population, and it will also describe the sections on the mental disordered patients. Okay. Then WHO, World Health Organization, this is the we can say the committee, and it is basically responsible for preparing and publishing the ICD. We can say the revised version of ICD 6 at every 10 years. So, ultimately the WHO taken up the responsibility to produce at every 10 years gap the revised version of ICD. ICD is the International Statistical Classification of Disease. So, you are going to study in detail about ICD 10, and after 21st century we are having ICD 11. So, nowadays we are focusing the ICD 10, and ICD 10 was formed in 1893 as the Bertillon classification of international list of cause of death was came out. The work on the ICD 10 started in 1983, but its approval by US FDA, WHO is given in 1990 at 43rd WHA, that is World Health Assembly. Okay. So, these are little bit historical background or the synopsis for the generation of ICD from ICD 1 to 6, then 10 and 11 version. Now, coming to the classification. Classification was as follows. Basically, the classification of disease we are talking about in this lecture, the systemic approach was adopted in classification of different organization system related diseases. So, according to certain characteristics of disease, certain characteristics means their salient features, or the particular disease can be classified better according to their etiological features, the presence or the occurrence of the diagnostic reports or the treatment schedules. Okay. So, according to certain characteristic of different diseases, or we can include here the different major injuries like the part of the body affected. Second is the etiological agent. Etiology means, students, the cause of the generation or the occurrence of particular disease, the etiological agent, and the kind of morbid changes produced by the disease. If we do not take the disease, the morbidity of that particular disease seriously, it will show a lethal or deleterious effects to that particular organ system also, and the patient ultimately will lead to mortality or the lethality also. Okay. So, we have to take any disease very seriously, and we have to go and report to our physician. Now, coming to the international non-proprietary name for drug, okay, which is nothing but the INN, and according to INN system of classification of drugs and disease, we are having different codes for ICD. So, these are different we can say the organization system of our body, where you will have in the bracket you are going to see these are the codes which will define the anatomical as well as the physiological changes or the occurrence of or alteration of normal homeostasis, means there is a generation of the pathological conditions. So, the first one is the example of certain infectious as well as parasitic infection, or we can say parasitic disease, and according to ICD classification, here the code is A002 capital B. You have to write these alphabets in capital. Remember this, students, A002 B99 within bracket. The second is the agents, or we can say the carcinogens, or any drug which is having strong potential to cause neoplastic changes or to generate cancers. So, this can be coding is C002 D48, D48 within bracket. The third one is the disease of the blood or the blood forming organs like hemopoietic systems, and certain disorders which involve the change in the immune mechanism or the agents which are having potency to we can say the immunosuppressive or immunostimulant agents. Okay. So, these are the codes given for this system is D52, D89. Next is the endocrine related disorders, or we can say the nutritional as well as metabolic diseases. Here we have discussed one example, the metabolic disorder, one is the diabetes mellitus type 2 basically. Okay. The code given for this class is E002 E90 within bracket. Next is the inclusion of mental and behavioral disorder. So, we can include here the psychiatric disorders or neuropsychological change in different class of patients. So, the code given here is F002 F99. Next is the disorders of nervous system. One best example of this is sometimes what will happen, this will be the condition of any age in the human being, the innervation. Innervation means there is sudden slowing, or we can say the lethargic condition of the nervous system, where our neurons in normal homeostasis also is not having enough energy to transfer the neurotransmitter from preganglionic to postganglionic nerve endings. Okay. So, this is the innervation, you can remember this terminology. This is the disorder, one main disorder of nervous system, and this can be coded as G00, capital G00 to G99. Next is the disease of eye and adnexa. So, this is adnexa is students the area we can say the layer of uterus which will connect the fallopian tube and the ovum. Okay. This is the area of the uterus. So, disease associated with the eye and the uterus is considered to be H002 H99 according to ICD 10 and 11 classification of disease. Next is the disease of ear and the mastoid process. I hope you remember about the mastoid process. You already learned this part in the skeletal system. It is just below the neck, we can say the mastoid area, which will control the hearing, or we can say the vocabulary process. Okay. So, the drugs or the diseases for the which will causes deleterious effects to the ear or also affects the mastoid process coming in the code of H62 H95. Next is the disease of circulatory system I002 I99, disease of respiratory system J00 to capital J99, then disease of digestive system capital K00 to K99, then we have disease of skin. Skin is considered as integumentary system and the subcutaneous tissue. Okay. L00 to L99, here we can include the dermatitis or the fungal infections, or so many we have psoriasis. Okay, students, the leukemias, these are all skin related disorders and diseases. Then diseases of mucoskeletal system and the connective tissue is considered or classified under the category of M00 to M99. Then disease of genitourinary system N00 to N99. Then the agents which are liable to cause, or basically these agents are contraindicated in the pregnant or the lady with are going to give their child birth, and also for the puerperium. This terminology is basically used for the females who are going to give their child birth or in a phase of planning of get pregnant to the next 1 year duration of time. So, these are considered to be or coded as O00 to O99. Okay. So, these are different codes according to ICD 9 and 10 classification of disease. Next, we have little more certain conditions that are originated in perinatal period. So, perinatal period, students, I hope you know, these are the time duration, the complete time duration of the pregnant lady, means the all 3 trimester or 9 months to next 6 months time, and these type of diseases or any morbidity are coded as P, capital P00 to P96. Next, we have congenital malformation, deformations and chromosomal abnormalities. Congenital malformation means congenital since from birth, means the neonate or newborn are born with that particular such deformity. Okay. So, congenital since from birth, deformations like some organs not developed properly or like hole in the heart, so many disorders are there. Then we have cleft palate or abnormal feet and the chromosomal abnormalities. So, for this we are going to study the mutagenic as well as genotoxic agents. Okay, students, and these diseases are considered as capital Q00 to Q99 classification of disease. Next, signs, symptoms and abnormal clinical as well as laboratory findings, their results are not always sufficient, not elsewhere classified. Okay. So, some diseases or we can say the morbidities, disorders which are not having or complete data of their etiological features, their reports, laboratory diagnostic reports are not sufficient anywhere. Okay. Or we can say these are sometimes the rare orphan diseases. So, these are considered as R00 to R99. Next, certain injuries starting from head to toe, any injury, major injury or the poisoning and certain other consequences of the external cause. It may be external bleeding or the injury, major injury, breaking of your integumentary system are considered to be as a code capital S00 to T98. So, these are different classification according to ICD 10. Then external cause of morbidity and mortality is considered as capital V01 to Y98, and the factors which influence the health status and contact with the health related services is given code capital Z00 to Z99 as per ICD 10 classification of disease. Now, we have little bit revision or we can say modification in ICD 10 to ICD 11. Coming to this ICD 11, ICD you know International Statistical Classification of Disease, the World Health Organization or the WHO is currently revising the ICD 10 to ICD 11. You know at every 10 years gap, the WHO, that is World Health Assembly, as per WHO and FDA have the responsibility to regularly at every 10 year we have to revise the next nomenclature or the classification of disease. So, right now we are having ICD 11 system with us. This development is taking place on an internet based workspace, like we have various softwares Java, Oracle, same we are having for the ICD system ICAT. You will see here the ICAT system, or it is the ICAT platform where the WHO connects globally and follow the GHS global health system, connect all countries to work or to focus different diseases on the ICD-11 same platform by following the ICAT platform. The draft for ICD-11 system is basically submitted to the WHO World Health Assembly in the year 2017 and its final version after proper revision or after getting its proper checking of draft and signed by the higher regulatory authorities, healthcare bodies, the final version came in 2018, the ICD-11th latest version. Okay. Next we have this table which will differentiate and gives you a clear cut idea about the advantages and the we can say limitation or the drawbacks also of the formation of ICD as per WHO system. So, the advantage is for by following this ICD system, either you can say for 10 or 11, we are having the fast aggregation of health related data globally. Okay. The second advantage is we are having a detailed or very good real time information about the current health conditions of different class of people, means starting from the pediatric, then adults, then geriatric health conditions of different diseases. Then third is the this ICD system gives us a wider analysis of community based health care system. Community means, students, like we are having after completing our B pharmacy, we are pharmacists. So, community based healthcare system means now we have to give our knowledge, share our knowledge to the neighbor or our society, or we have to help them, okay, who do not know about the conditions or particular disease, what medicaments they should take, okay, how, where they have to go to report if they feel any adverse effects after taking different class of drugs. Okay. So, wider analysis of community health we can get by this ICD system of classification of disease. And the next is the global health assessment. Global again, because we are talking about the global health condition, the ICD is globally universally acceptable system of the classification of disease. So, we have a global health assessment at every 10 years. Okay. Then the limitation of ICD system is, the first limitation is the decision or the discussion is limited to classified disease. This you will have an idea, because in our previous slide you are going to see several codes of ICD-10 as well as 11 ICD system, where the codes are given for different physiological or the depending upon the organization system. So, there are some more systems which are missed. Okay. So, discussion is limited, only ICD can give elaborate the codes for specific organ related diseases or disorders. The second one is the common term description of the disease is insufficient, or we are sometimes found lacking of some conditions, like we have integumentary system related disease, skin disease, but the terminology is not there in that particular code J00 to J99. So, this is one more limitation of ICD-10 and 11. Next is it also covers the most common disease. Again, when we are like you know about the next resistant strain of coronavirus, again we do not have the classification for the rare or the orphan disease. And the fourth is the country specific modifications of certain disease, like again we are talking about it is a GHS system, globally health organized system, but depending upon the occurrence of morbidity or mortality on different countries, the specific slight modification of the treatment schedule and the classification of dosing of drug is differ from country to country. So, this is also one limitation of ICD. So, this is all about today's lecture. See you in next lecture. Thank you.